Hello everyone, you're watching sqadia.com and I am Hammad Haider. Today, our topic would be to discuss the injuries around the wrist. We will have 5 sections. In the first section, we'll be discussing the carpal injuries, their clinical assessment, imaging, and what's the role of arthroscopy in imaging of the ligaments and what ligaments have injured, and then their principles of management. Then we will be briefly moving on to the fractures of the scaphoid, which is one of the most common wrist injuries, especially the carpal bone fractures we encounter in trauma. Which we'll be discussing the mechanism of injury, its pathological anatomy, clinical features, and what are associated treatment and complications. In the third section, we will be briefly going through the carpal bones fracture, triquetrum and hamate, the trapezium and the capitate, and we will briefly going through their fractures. Although these fractures are uncommon, but once they present, they're sometimes easily missed. And lastly, we'll be going through the fractures around the lunate. In the fourth section, we'll be briefly going through the ulnar sided wrist injury, especially the ligamentous tear, triquetral instability, as well as the triangular fibrocartilage complex injuries. In the last section, we will be discussing the carpal dislocation and subluxation. One of the two most common is the lunate dislocation and the perilunar dislocation. Especially, we'll be discussing the transscaphoid perilunar dislocation. Thank you very much. Keep watching sqadia.com.